Hey guys, Curtis Alexander. Let's talk about metformin and specifically some warnings that you need to take into consideration if you're on metformin or you're considering starting it. I think a lot of these things are left out in other videos. I think they're important for you to know. So obviously we know metformin is a drug that is used primarily in people with diabetes. Some people will take it for anti-aging effects. Regardless of why you're taking it, the numero uno biggest thing that we're concerned about is you developing lactic acidosis, which is basically a buildup of lactate in the system. And a lot of these things I'm going to discuss are going to come back to this, okay? So as far as lactic acidosis, if you're taking metformin, the problem with lactic acidosis, it's extremely rare. It's much less than one patient in 1,000 is going to develop it. So it is very rare. But if it happens, it's subtle, it's non-specific. It can show up as just fatigue and kind of almost flu-like symptoms. You just don't feel that good. So you really need to pay attention in case it is that. So lactic acidosis is our first big warning. Next, you and your doctor need to make sure you're monitoring your kidney function. They're going to do that through measuring your creatinine clearance, is how it's usually done. You want to make sure this is done before you ever start metformin, and you want to make sure that you're doing it at least once a year while you're on it. The reason for that, metformin is cleared or eliminated from your body via your kidneys primarily. If you have poor kidney function, metformin can build up. We can increase our risk of lactic acidosis. So make sure that's being done. Next thing is drug interactions. Make sure to ask your pharmacy to run one if you're taking other medications that maybe cause your kidney function to go down or your liver function to go down. We want to know about those things because, again, we can increase our risk of lactic acidosis. Radiological studies. This is one that's not talked about a lot. For example, if you're doing something like a CT scan, okay, what can happen is it can cause a minor or an acute drop in your kidney function. Again, if you're not clearing metformin, that's a problem. What you want to talk to your doctor about is what they normally do. They will have you stop metformin, say the day of your procedure or the day before you get the procedure done. You wait 48 hours and then you restart only after you've drawn labs for your kidney function. So that's generally how it's done. Anything that causes low oxygen in your system, for example, if you have heart issues, particularly congestive heart failure, something like that, low oxygen environments put you at a much higher risk for the lactic acidosis. Surgical procedures, very much like radiologic procedures in the fact that they can cause a drop in kidney function. Temporarily, people bounce back from that, but you want to follow that same procedure that you would for a radiologic procedure. You want to do that with surgical procedures. Okay, this is a legit one. People hate to hear this because they're like, can I drink when I'm taking this? You can, but you have to be very careful with metformin because if you're drinking too much, you're going to see blood sugar swings. You're going to see potential liver problems. So yes, it is a legit warning. You do have to really be careful drinking alcohol while you're on metformin. That leads us to poor liver function, Kate. Now, just like we were talking about the kidneys, for you to be able to clear metformin or get metformin out of your system, you have to have good kidney function. To be able to get lactate, to prevent lactic acidosis, to get lactate out of your system, you have to have good liver function. So that's important. So we need to make sure we're watching not just kidney function, but liver function. You may have heard that there's some warnings about, hey, if you're taking metformin, your vitamin B12 levels may get too low. That is true. It's something you need to watch. It only happened in roughly 7% of patients, and the ones that did get low B12 levels didn't usually manifest. They didn't usually get symptoms of it, but it is something you want to watch out for. But there's another vitamin we're going to talk about that's even more important than the B12 that's very seldom talked about, okay? Any change in clinical status. If you've been taking metformin for a while and you've been doing good on it, and then all of a sudden you notice that there's your blood sugars aren't doing as well, those sorts of things. You want to be really careful with that because that tends to be a sign that you could be at risk for lactic acidosis. Again, you're seeing this big trend. All these things can feed into this. Low blood sugars or hypoglycemia. Okay, if you're on metformin, you have to be very careful about going on any sort of low calorie diets. You know, I'm not a fan of low calorie diets, and I've got many videos on why, but doing a low calorie diet when you're on metformin puts you at risk for low blood sugars, as does over exercising. Okay, if you're doing something like CrossFit or high intensity interval training, you have to be very careful and listen to your body, particularly if you're trying to do that combined with a low calorie diet. You're going to induce stress. That stress can cause blood sugar swings. Other glucose lowering drugs. It's not uncommon for people to be on metformin and to be on something like sulfonylureas, which cause you to put out less of the insulin so you can have low blood sugars, and ethanol, the alcohol, if you're drinking alcohol. Again, we kind of talked about that, but those are 4 things as far as low blood sugars we want to keep an eye out. And finally, the vitamin I was talking about, and I did a video recently on thiamine or vitamin B1. What most people don't realize, and you can go watch the video, I go into much more depth, but diabetics are notoriously low in vitamin B1, and vitamin B1 is critical for diabetes because it helps you metabolize carbs. I think a lot of people blame carbs when we should right off the bat be looking at, are we giving our body the nutrients it needs to be able to metabolize carbs? If you don't have enough vitamin B1, you're going to have difficulty doing that. To compound the problem, what it appears at this point is that metformin can actually lower vitamin B1 levels even more. So if you're diabetic, you may have low B1 levels. Then you give that diabetic metformin, it's going to go even lower. You have difficulty processing carbs, and then we run into all sorts of other issues. So this is something you really want to pay attention to. Human thiamine transporter, I put that there because there's a transporter that goes into your cells. Thiamine has to use that transporter to get into your cells. Metformin appears to use or block that same transporter, which is what we think is happening. There is some debate kind of in the medical community that this is a thing, but I've seen enough evidence that I always warn people, if you're on metformin, you have to be very careful about your B vitamin status. Okay, so that's it, you guys. Make sure I talk about this stuff, including 11 other natural therapies I personally use and recommend that are safe and they're effective. If you go to my website, link in the description, I'll send you that free checklist, you guys. So let me know in the comments any other questions or topics that you'd like me to cover. I would appreciate that. Thank you guys. See you in the next one.